It is. I mean, like I say, it's 40% men and 60% women, so it might as well be 50-50. And, it can happen to anyone in terms of that kind of predisposition and the environment that triggers it. So it is. But I think we're going to see, if we give it enough time, we're going to see a lot more men, even in those conditions that you said. Certainly is leaning much more towards the women. And the reason is because I think it's easier for men to allow themselves treatment in binge eating disorder than it is a lot of times for men to admit they have any psychological disorder. They want to say, I'll check myself in for a month and that's it, I'll get better, I'll do what you tell me and do it. And they really don't connect to this kind of essence of feeling your feelings and realizing how important it is. So if you address this, okay, this is a stress disorder. No, it's just something I'm lazy, I don't exercise. And that's really hard to get them to realize, wow, there's a lot, like for example, a very large group of people who struggle with binge eating disorder are firefighters. Okay, and you'll see them, especially as they get older, they'll develop this intra-abdominal fat. Okay, but it's such a stressful job, and the eating situations are overwhelming, and there's a lot of this kind of macho situation. But they're not going to share that with anybody. They're not going to need help. I can do this myself. But really, they keep doing it and doing it and doing these diets and so forth, and eventually they kind of have suicidal ideation. Let's say because of the trauma of the firefighting, but it's something that happens. Law enforcement the same way. So they're just kind of unwilling to kind of get that treatment. So the nice thing is I can go into a treatment center for binge eating disorder, and I will see men and women. I go into it for anorexia and bulimia, I might be the only male. So you see that a lot of treatment centers that treat males have kind of passed away because there's a need, but there's not enough men going into treatment. So I agree that it's probably much larger because you're talking anywhere from 3 to 6% in terms of a true diagnosis of binge eating disorder versus 1% anorexia and maybe 2.4 to 3% bulimia nervosa. So you almost got twice as much, and that's a large population that you're working with.